For these possible volunteers, being told the lethal realities of Ebola is just a first step, answering a healthcare calling that brings with it the risks of a life and death sacrifice.
Yes, you're absolutely right, it is risky, but the chances, the probability of being infected as a volunteer working in a UK-run facility is smaller.
There's another challenge healthcare volunteers would face in Sierra Leone, tackling trauma, as statistically most of their Ebola patients would die. Those who've already volunteered in the UK view their task with a mix of emotions.
We've seen a lot of healthcare professionals dying, and 4 doctors who already, contracted Ebola and died. So that is always in the back of my mind.
I have no concerns about going down to help my people. It's a call to action, and the UK is leading that call, and I know that we will be trained before we are deployed.
As it happens to the soldiers going to war, they know there is war, they know I might be killed, but they go there to defend the country or their country. So I'm also going there to show you as a soldier, a medical soldier or a health soldier, that there is something, there is risk, but we all need to fight this war together.
Britain has already sent 700 troops to Sierra Leone to help in the fight against the epidemic. Work underway to build new isolation centres. Volunteers essential, say organisers, to run them.
To stop the spread, you need to isolate the sick. To isolate the sick, you need them to be in facilities. For the facilities to work, they need to be staffed.
While part of an international response to the Ebola crisis in West Africa, for those leaving Britain to help out, volunteering is also a moment of quiet, personal reflection. Richard Bestic, CCTV, at the Royal Society of Medicine, London.